made me think, why don't you want to, in terms of talking about fixed points and mobile points, let's talk about a little bit of classification of movements, how we classify a movement, how DNS describes the classification of movements. Maybe to put it into context, I can describe how I believe DNS essentially describes movement. And in seminars, I talk about to the students, I say, if you think the very top of the list is just your basic posture or movement. That's what we're talking about. From there, that gets separated into two categories. The pattern is either undifferentiated or it's differentiated. Undifferentiated is talking about in terms of support points and mobile points. Undifferentiated means that the limbs are moving in the same direction. Now that's the tricky part, because we think we're talking about fixed points and mobile points, but you can either talk about fixed or you could talk about mobile. In terms of undifferentiated, as long as both limbs are performing the same function, whether or not that function is stability or whether or not that function is phasic movement is irrelevant. It's undifferentiated if they're the same. So an example of an undifferentiated movement would be supine 3-month position. If you're lying on your back, both of your arms are in a phasic function. Therefore, they're performing the same function. Therefore, it's undifferentiated. Squat is another undifferentiated position. Both feet are in support function. Therefore, since both lower extremities are supporting, they're doing the same function. It's undifferentiated. The other category is the differentiated. Differentiated means that one limb is performing one function, the other limb is performing the other. And because you have this duality, you have to separate, well, how do you compare the upper extremities to the lower extremities? If the support points, for example, are on the same side of the body, then that is an ipsilateral differentiated pattern. And if the support points are on opposite sides of the body, it is a contralateral differentiated pattern. And that is pretty much how you can define any type of movement or posture that you see in life. But things, I think, tend to be a little bit more complicated. I think that's a useful way of describing things. But more recently, we've been talking about maybe other ways of describing it that might not be better or worse, just a different, I think, way. So I think the first thing that you had said or we had talked about was the idea of the very first thing you should do is really define the position in terms of how many support points there are. Is that accurate?
I think so, yes. Yeah. I think so.
So that means that, first of all, you have to know, you have to see where the support points are. A lot of the times it's obvious. So if I'm squatting, there are 2 support points. So we can describe this as I actually think, how were we describing that? Do you remember? Or
well,
how were we
the thing is, was it central? Was it peripheral support points? There are 2 support points on the same side, diagonal. And
that's
so
right. Well, we said if there's 2 support points, then it is a bilateral support point. But then, depending on where the support points are they on the same side of the body, opposite side of the body?
So whether ipsilateral or bilateral. That's right. So in that case, it would be bilateral up or bilateral low. The problem becomes when it's a little bit like joint centration. If you define it only by position, it quickly becomes messy in the long run. Because originally, when we looked at support points and mobile points, we also defined them by the direction of movement. We said this is so it came from the Voiter positions, it came from stepping forward. So we said both limbs are stepping forward there. So it wasn't only that they were performing the same function, they were moving in the same direction.
That's the tricky part.
So when you start describing other movements where the limbs are on the same side, but they're not moving in the same direction, but I'm lying on my side, my leg is going back, my arm's coming forward. Well, you can say that's an ipsilateral undifferentiated, but to a novice's eyes, that is not an undifferentiated pattern.
Right.
If one
the idea
arm is
that
moving.
one limb is phasically flexing,
Yeah.
the other limb is phasically extending.
Now I have to explain that.
Yes.
Yeah, because otherwise we both have two different ideas. If I wrote down ipsilateral with support on one side and phasic on the other side, well, you could draw me two different pictures. Which one am I talking about?
Right.
That is where the problem arises when we only define either by position or by movement, or by function or by position. Right. We have to have at least two
qualifiers, maybe.
Qualifiers, yeah.
Well, and I think now that you're saying this, I'm remembering too our initial conversation, which part of what made you bring this up, or where it all started, which was I was using the word undifferentiated as a synonym to homologous.
That's right.
And I think there might be some, well, I was using it as a synonym, and you were very confused by this.
Yeah.
And I wasn't. I said, well, it's homologous is undifferentiated. And then you started to pose questions like, well, what if one limb is moving, flexing, the other's extending? Is that homologous? And I thought, well, no, actually, it's not. So that is definitely part of it. It's the undifferentiated and differentiated can tell you the location of the support points, but it doesn't tell you the function. It doesn't tell you the direction in which limbs are moving. Those are reserved for homologous and heterologous. I use the term to determine, both arms are phasic, but if they're both moving in the same direction, it is phasic, it's undifferentiated homologous. Yes. If they're moving in opposite directions, it's undifferentiated heterologous.
That's right.
Then that can start to accurately, you said, you don't even have to see it. I can just say the words, and you would be able to draw me the picture. You would accurately know what I'm doing.
So there is a need, I think, to keep in mind that the terminology is not sufficient in the sense that it worked when we were doing the global movement pattern. That's a fixed kind of pattern. So everybody understood exactly what we meant when we said it's a turning pattern, ipsilateral side, and you have stepping forward, a phasic arm and leg, and support function. Yeah. So when you have a defined pattern, then that terminology stands because there are no variations. But once you're in the movement analysis of patterns that people present to you from ADLs and so on, then it doesn't hold, because then it's confusing.
Yeah. Oh, it is confusing. And it's even, I think that's illustrated by the year, even within the courses, when we're talking about how, baseball pitching is an ipsilateral pattern. You look at that and it's not immediately apparent that is a turning pattern. You really have to understand what you're looking at. You have to understand the word ipsilateral. Even, people take DNS courses, and then I ask them what an ipsilateral pattern is, and they can't give it to me. So then to be able to think that everybody's walking around just identifying patterns when they don't even know what the words mean is disheartening, first of all.
Yeah.
But if you enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook @IMTR Seminars.